Awesome. Okay. Hi everyone. Thanks for joining today. We're really excited for our panel celebrating excellence, Hispanic excellence in U.S. healthcare. We're gonna give folks another minute or two to join, and then we'll go ahead and kick it off with introductions and kind of the first couple of questions. So I'll just give everyone another 30 seconds or so. And Carlos, can you hear me okay? It looks like the screen is a little frozen on my end.
No, we can hear you, yeah.
Okay, great. Maybe my computer is unused to the dozens of folks joining. Okay, I'm gonna go ahead and kick us off. So good afternoon, everyone, and thanks for being with us today. Before we dive in, I just wanted to let everyone know that I have some questions prepared, and we're so lucky and excited to have these speakers today. But if there's other questions that come up, I'm gonna try and reserve a little bit of time in the end. So feel free to write in the chat or use the questions feature in GoToWebinar, and I'll try and get to those at the end. So to kick us off, this is the panel today celebrating Hispanic excellence in U.S. healthcare. I'll briefly introduce myself. I'm Madeline Dean. I'm the proud daughter and granddaughter of Cuban and Puerto Rican immigrants, and I lead the business side of virtual specialty care at Rubicon. It's my pleasure to introduce our incredible panelists today. So we have Dr. Ana Fuentevilla, the former Chief Medical Officer of Optum Population Health Solutions. We have Melinda Barnes, the Chief Medical Officer at Roe. And then, of course, many of you know Carlos Reyes, our founder and president, co-founder and president at Rubicon MD, also my boss. And I'd love to start out by just going around the group and having each panelist introduce themselves professionally and explain their connection to Latino or Hispanic identity. Ana, let's start with you, and then we go Melinda and Carlos in that order.
Awesome. Happy to go first. Hola, buenos días. I'm Ana Fuentevilla. I'm the, former Chief Medical Officer for Optum Population Health Solutions. I'll start by telling you a little bit about my professional background. I trained in the Southwest in internal medicine and geriatrics, and my specialty is really serving seniors and individuals with disabilities. But you'll see throughout my career as a Latina leader, I've really taken care of multiple populations across the U.S. My specialty is really in long-term care and hospice and palliative care. That's where my passion truly lies. I had been at United Health Group big chunk of my career, almost 3 decades, 26 years in multiple leadership roles. It was an amazing career, and I was provided lots of opportunity to always do the right thing and grow as a Latina physician leader within the enterprise. I'll tell you, the first role I had was really impactful. I was the Arizona Medical Director for over a decade as the leader for Medicaid and Medicare services with a real focus on long-term care. And but more recently, I think 2 really impactful roles that I was privileged to have was I was the National Chief Medical Officer for United Healthcare for the Medicaid and Medicare long-term care programs. And in that role, I served and really was clinically responsible for health outcomes and quality for over 6 million people across, back then, 26 states. And then more recently, as Optum's Chief Medical Officer for Population Health, I led and was responsible for care and condition management programs that served many aspects of the health system, including employers, public and private, provider groups, but something to explain why I'm here today and the importance of the work that we do in collaboration with other parts of the health system in that role at Optum was the example during COVID, the beginning of COVID in New York City, where my area of Optum partnered with the fire department in New York City at the peak of the pandemic, when New York was not able to manage the surge. And we partnered with fire department of New York to take the low acuity calls off their plate, so that people that really needed the medics and the emergency department could actually go while we were taking care of the lower acuity calls. So that's an example of one of the roles that I had at UHG. But I think the things I'm proudest about in my almost 3 decades at United Health Group was the Latino focus of the things that I was able to do as the UHC Chief Medical Officer serving Medicaid and Medicare. In collaboration with our Chief Medical Officers in 26 states, we've launched health equity action plans for every single Medicaid program. Additionally, we focused years ago, but even now more importantly, on maternal and infant mortality, really trying to address the issue of our Black moms, Native American moms, Puerto Rican moms suffering 3 times the mortality, and babies as well. So that was an area that I'm really proud at UHG. And then a couple other things that are really important is the Diverse Scholars Program. I was the physician lead for that for UHG for many years, where we offered $30 million in scholarships across the diverse population of students to go into the health professions. And then more recently, I served on the board for equity advancement, really critical at UHC, where we finally are putting our foot down on inclusion, diversity, hiring, promoting, and getting Latinos into management and into the C-suite. And then lastly, right before I left, helped co-launch the Unidos Latino virtual community for the enterprise. So those are some things that, focus really on our community, the Latino community. My background, and then I'll turn it over to my colleagues, is on a personal note, I too am a Cuban. I was born in Cuba. I'm a political refugee from the time I was an infant. And I think what is really important about what influenced my career and my professional life is my personal experience as an immigrant to this country, feeling the racism, seeing the prejudice, and as a young kid, acting as the translator for my grandmother, I remember not understanding what the doctors were telling her, and then she going home, Spanish speaking only, not being able to really take advantage of healthcare. And I would say, raised in the Southwest in New Mexico and Arizona, I was able to say, I want to be a doctor. I was the first doctor in the family, and really served in our Latino and Native American populations early in my career. Turn it over to you.
Amazing. Well, there's a number of themes we'll come back to there on the kind of personal journey, the health equity and advocacy work. So I'll hand it off to Melinda to introduce herself, but thank you so much for sharing.
Thank you. So hard to follow after Anna. Good afternoon, everyone. My name is Dr. Melinda Barnes. I am a board certified facial plastic surgeon and ear, nose, and throat surgeon. I'm proud to serve as Chief Medical Officer at Roe. And Roe is a direct-to-patient healthcare company. We provide nationwide telemedicine, telepharmacy, at-home diagnostics, and in-home care. We see patients in all 50 states plus DC. I'm very proud to say that we have at least one patient in 98% of all primary care deserts in the United States. Following Anna's lead, so Anna, my education and professional journey, I was born in LA, was raised in Atlanta, went to college at Stanford, so in the Bay Area. And we can, get into this a little bit later, but I think I probably represent a different Hispanic identity and sort of even experience. Looking at me, I don't have the sort of classic Hispanic look. I'm representing Panama. So a lot of my experiences, especially growing up, are coming from my mom is Black American. So experiencing life first as a Black woman. And I think that has had definitely its challenges. And so my experiences as a Hispanic woman have been a lot of positives in terms of being able to be kind of a under the radar advocate. I don't have a Spanish last name. Again, I don't have the classical, Spanish look or Hispanic look. So I've been always able to advocate for, let's say, English as a second language, or undocumented immigrants, or just thinking about access, especially in our community, whereas we look at higher populations of gig workers, higher population of under or uninsured. So, we could talk about it later, like at Roe, but thinking about the cost of a doctor's visit, thinking about the hours that our doctors are available to speak to patients, thinking about the reading level of our website, of our online visit, all of that I feel like is second nature for me to think about. And it might not be for other people who are not dealing with family members that don't speak English, or speak English but have a hard time reading it. So that's been a very interesting journey for me. I think, being in California, most people think of Hispanic as Mexican. And again, I don't look Mexican, so that was never sort of an identity, I think. And then I went to Stanford, but when I went to medical school in New York, it was a period of enlightenment, because most people didn't think I was Panamanian, but they thought I was Dominican or Puerto Rican. And so for the first time, people were coming up to me speaking Spanish. One of my fondest memories of medical school was one of the private practice obstetricians paging me over the hospital PA, because he needed translation for a woman that he needed to use some instruments on to deliver her baby. And he remembered that I spoke Spanish and called for me to come. And that was very cool, because I kept thinking, we're in New York City. You probably could have just stuck your head out into the hallway and just been like, I need some help. And 5,000 people could have run to you who spoke Spanish, but he connected that with me. And so I've been on a very interesting, just personal journey of the intersectionality between being Black, being Hispanic, being a woman, being a physician, working in health tech, all these things that are sort of, now I'm able to blend all of that together and really be proud of all of that. So it's been very interesting and very fulfilling to be on this journey. I went back to Stanford. I did my residency there in otolaryngology. I went to Portland, Oregon for my fellowship, which is probably one of the least diverse cities in our country. And that was also very interesting, because, hearing people, and of course you can confuse Portuguese and Spanish, but hearing, people calling Brazilian immigrants like Mexican, or saying, we need to get a Mexican translator when they really need a Portuguese. And so a lot of advocacy work was done during my 1 year there. And then was fortunate to join faculty at Yale, where I joined the Department of Surgery and started their facial plastics program. And then after that, came to Roe. And we have had a lot of work with advocacy. I also sit on the board of directors for the Fund for Public Health of New York City. So just like Anna mentioned, the increased mortality rates of Black and Hispanic mothers, we have a Mothers and Babies Fund that we fundraise for, specifically to target that, because in New York City it's 8 times higher. And I can tell you, as a mom to an almost 2-year-old delivered at Mount Sinai, I specifically looked for a Black or Hispanic or woman of color physician for my care, and then also chose Mount Sinai because I wanted to tell people, hey, I went to medical school here, like, take care of me. I'm connected, I'm part of the family, because to be honest, even as a physician, I was terrified. We know that there's no protection for socioeconomic status or education, so I'm just as likely to pass away from childbirth as any other Black and Hispanic woman in New York City. And so very proud of the work that I do with the Fund for Public Health of New York. And then lastly, I'll just say for Roe, one thing that we really saw was when we partnered with New York State to do the in-home COVID vaccine drive, where we were vaccinating homebound seniors against COVID-19. We got a lot of outreach from public officials in Suffolk and Nassau County, wanting to know how can they improve vaccination rates in Hispanic communities, especially amongst undocumented immigrants. And you know, my 3 points that I routinely gave them was one, be humble, right? You're not the great white hope coming in to save the community. Be humble. Two, active listening. Go to the community and ask them, how can we help? What are your fears? And I know this from being a surgeon. There are a lot of misconceptions in the community. I remember one around, taking out tonsils, misconception if little boys have a tonsillectomy, they'll be sterile. And so addressing that head on and not being afraid to identify and correct any misconceptions. And then lastly is be engaged. There are so many community partners and network who know the community. They know people by name. Partner with them and let them tell the community about vaccinations, and then provide them with resources versus coming in and trying to do it your way and what you think to be the right way. So those are just some of the ways that I've tried to be sort of an advocate and an ally over the years.
Amazing, amazing. And I'm glad you brought up the commentary around intersectionality, because I think it's so important as we think about kind of the Latina or the Hispanic experience in the US. And so excited to talk on that more, and also a lot of the powerful work you mentioned. Okay, I'll hand it off to you, Carlos, last but not least.
Thank you, Maddie. Yeah, I was listening to both backgrounds and, wondering why you invited me. I don't really have much to add, but I realized that one thing that's very different is that I do have a different background from the perspective that I grew up outside of the US, right? So I am originally from Spain. I was born and raised in Madrid. The reason I got interested in healthcare was my own experiences with the system. Unfortunately, when I was a kid, when I was 8, I had this accident in my eye. We were playing with other kids with slingshots, and unfortunately I got hit in the eye. And that was the beginning of 3 very difficult years where I had to undergo 3 major surgeries and tons of complications, and unfortunately ended up losing sight on my left eye. A lot of those things could have been avoided had my clinicians been able to use technology like what we build at Rubicon MD. But that's the flip side. Of the bright side of the story is that's pretty core to the inspiration for eventually starting the business. But before I started the business, I did grow up in Madrid. I did my undergrad in Spain. I did my engineering school there, and then for years I worked in between Spain and Latin America. So really, my first time in the U.S. was my first job, 2008. I was in Pennsylvania working at Siemens Medical on their EMR. And that was the first time that I was kind of shocked at how, yes, to your point, Melinda, I was generally categorized as, Mexican in most of the places. And then after a few more years in Europe, came back to the US for school, for business school. And after that, I started the business met Gil and started the business with him. One of the things that's been really interesting for me over the years is I grew up in Spain as a Spaniard, right? So I did fit in. I had what you could call the equivalent of the white privilege there because, everyone is Hispanic. So I didn't really, I wasn't really exposed to any sort of, discrimination or inequity from that perspective. And that kind of made me a bit naive about it. So when I came to the US and we started the business, if for whatever reason, somebody wasn't interested or was, devaluing the work we did, the last thing that would come to mind is that, there is a bias against, some of the, ethnic groups or Hispanics. So it took me years to realize how much more difficult it is for certain communities to break through and to do things here, and how much bias there is in the system. So I guess even my own journey, I had to realize that no, I would just assume, there's something else. Just keep working on it. I think that's an interesting perspective. That's a bit different to both of you guys having grown up here. And then on the day-to-day, one of the things we've seen with the business around the topic of equity, it's been pretty magical to be able to provide access to the best expertise for all populations. Like you guys talked about California. I think in California we have this, micro example where if you go to some of the biggest tech companies in the Bay Area, they will use some of them have on-site clinics, and their clinicians will use Rubicon MD, and it's a really cool experience. Their employees love it. They improve outcomes. They reduce total cost of care. But those patients are, they could take a day off, drive to Stanford around the corner. They have the best insurance. They have all the access in the world. And then 20 minutes from there in the Alameda County, we have this really big implementation with hundreds of PCPs, all of them practicing at FQHCs, taking care of the population that's primarily Latino and Asian, and they have zero access. They can't take a day of work because that means that day they're not, bringing food to their table. They can't afford transportation. There's no specialist who wants to see them because, they don't take Medicaid or they just don't have that access. It's been pretty powerful to see how, for both, whether you are at the top or the bottom of the pyramid from that perspective, we're bringing access to the best specialists across the country to their PCPs. So when we talk about our mission to democratize access to medical expertise, is in those examples where it really comes to life.
Amazing, amazing. And one of the reasons I'm proud to work at Rubicon. Okay, so we're gonna dive in. There's so many themes and questions I have just based on the impressive backgrounds that you all shared. But I'd like to start kind of with the health equity piece that you all mentioned. Hispanics make up the largest and fastest growing minority group in the United States. We are 3 times as likely as white Americans and nearly twice as likely as Black Americans to be uninsured. We experience much higher rates of diabetes than white Americans, and along with Black Americans, have been especially hard hit by the COVID-19 pandemic. Also, as astutely brought up by Anna and Melinda, maternal outcomes are significantly worse for Black and brown populations, including Hispanics. So with those existing health disparities in mind, how do you think about integrating health equity into leadership of your current or most recent institutions? And what has been the most challenging aspect of doing so to date? And maybe I'll start with you, Anna.
It's a great question. And I think I mentioned, from the beginning of my career, I've been passionate and really looking at health disparities from the very beginning, 3 decades ago. And now I look, it's 2021 going into 22, and we're still talking about health disparities across America. And instead of them getting better, really, truly, we are seeing worsening, right? The maternal mortality issue is front and center, and it's horrific. And then we've got COVID that is showing us that, definitely disparities have gotten worse. And in fact, for the Latino population, what did we just read last week? We have seen a degradation in longevity, right? Now, if you're a Latino in America, you're not going to live as long as you did as you did 5 years ago. So I think we're seeing degradation and worsening of disparities, not improvements, and that's a disappointment for me as a 30 years in the healthcare field. And so I think that question about how do we integrate health equity as a priority into leadership is a critical question, really is. And I think there's a few things we could do better that maybe will help us get there, will help us solve and create equity across America for all populations, especially Black and brown. And I think what I've learned and what we really were trying to do, especially more recently at United Health Group, was it needs to be part of the mindset of the business leaders, right? To really create health equity, we need to build it into our DNA across all of the health sector, and it needs to be built into our business models. We can't create equity if we leave populations behind, and we've given a couple examples, COVID and moms. And so I think that's a number one. And I think leaders that see that, leaders like you, Carlos, and your colleagues at Rubicon that are saying, okay, if we're going to create equity, that means leave no population behind and offer services to all populations, especially those in most need. So that's number one. Number two is I really think that we need to have people like us influencing that, right? So we need Latino leaders to lead. And their only way to do that is to really demonstrate inclusion and diversity. across all of the businesses serving in health. And that means really making it real. It means hiring the right people, hiring to, if 18% of the population in America is Latino, we ought to be hiring 18% of new hires should be Latinos. And similarly, our managers need to be Latinos, and we need to elevate Latinos into the C-suite. So I think that's critical. And then lastly, I'm going to say, there's no way we can solve this alone. Healthcare is not going to solve this alone, right? We have to partner with all other sectors, from transportation to social services to, all the businesses that hire the Latino workers. Half of the workers in essential jobs, essential workers impacted by COVID are Latinos. We need to work with those sectors as well to solve it, because we can't solve it alone. And I think an example of that is essential workers, right? Where if we don't address education and wages and time off when you're sick so you don't go to work with COVID, we're not going to solve the inequities. So I think it's really partnerships is the last thing I'd say is, leaders need to establish those partnerships to work with other sectors to really make it real.
Awesome. Linda, Carlos, other thoughts to share on that topic?
Yeah, I think Anna really hit the nail on the head, if that's the saying. Absolutely. I think that leaders, it cannot be a second afterthought of, oh yes, we need to address diversity or inclusion. If you think about it, most of the companies now are talking about democratization of something. We say the same thing, democratization of healthcare. And I like to look at sort of 4 aspects to say if we are really hitting that democratization. And 1 is access, 2 is cost, 3 is effectiveness, and 4 is experience. And so I think access is huge, and that's where a lot of companies fall short, because they think access means just like putting up a website, or the hours that the brick and mortar clinic is open, or putting a clinic in a certain neighborhood. But as we've all sort of alluded to, if we're thinking about essential workers, they do not have time off. They do not have coverage. So what does it matter if there's a clinic in the neighborhood if no one can go to it? And so I think when we think about access at Roe, we see just as many people at 8 a.m. on a Tuesday as we see at 8 p.m. And in fact, the majority of our visits are outside of normal business hours. So the majority of patients are coming to see us after 5 and before 9 a.m. And one of the common themes is the patients are not choosing between going to Roe and going to Columbia or Stanford or UT Southwestern. It's really Roe or nothing, because they cannot take the time off. And like Carlos mentioned, it's not just time off, it's lost wages, which means less food on the table. It means maybe not hitting rent. It means maybe your child can't go to daycare. So we really do have to think about this holistically. And I think that the community partnerships are essential. These are the people who are out, hitting the pavement every day, trying to understand what's going on in the community, making sure that access includes language. It means, again, addressing, either cultural misconceptions or even like rumor mills going through the community. It means establishing trust. And it's understanding what all goes into this. When I was in California, I had the opportunity to do some work in Central California. And one of the huge things there is you have the migrant farm workers. So you see someone and then you set an appointment for them to come back in 3 months. They're not even in that location anymore. So how do we address that? Like, how do we have mobile clinics? How are we keeping track of the patients because you're doing a free clinic or you're doing a vaccination? I was at the Panamanian Day Parade in New York City. And yes, there was a COVID-19 vaccine or vaccination booth, and then there was a COVID testing booth, but it was so not integrated into the day or into the culture. I just kept thinking, let's get some of the dancers, let's get one of the DJs to shout out that he's going to get vaccinated, or that there at least is a vaccination booth here. Let's represent something about Panamanian culture and our history, and talk about how we need to get vaccinated in order to protect ourselves. But something that shows that you hear us, you want to, you want to work with us. And I think that's something that is key and missing, is that a lot of times we feel like we're just hidden in plain sight, where we have all of these needs in our community and really no one is talking about them, even though they're so blatant. And I think lastly, on the hiring front, that is essential. At Roe, we have, and we've been very public about our diversity, equity, inclusion efforts, and our goals to have our employee population reflect the population of the United States. So just as Ana mentioned, if it's 18% Latinos in the United States, we need 18% at Roe as well. And also thinking about diversity at every level. We have decided to focus on the tech org because that historically has been the worst. And so that's hiring engineers, product managers, designers, data scientists, and making sure that we are looking at people from all backgrounds. I would say one of the benefits of us being a remote now is we can prove over and over again, there isn't a pipeline problem. There are Latinos throughout the country and Black Americans who are skilled, if not overqualified for positions. And now we see that when you're not looking at potentially moving to New York or the high rents or, being able to live in a different location allows you to potentially take care of your parents, or if you're like me or Anna, first generation, going to college, being a doctor, there's a lot that we're still giving back to our families, whether it's paying their rent, sending them money. And so we have a lot of responsibilities that our coworkers and our colleagues just don't know about, they're unaware of. And so how do we support that? And I think companies looking at holistic benefits, whether it's financial planning and just helping some more of the like first generation professionals these days be better equipped is also very helpful in the hiring aspect as well. So totally agree, there's partnerships. It has to be, your leaders have to see the value in having a diverse workforce. And then lastly, before I forget, also I think, especially for Roe, making sure that what we put out in the world is reflective as well of our patients and the patients that we want to have. So that means having inclusive imagery on our commercials, our website, our landing pages, all of our social ads. If you look, we really try to be very diverse across gender, identity, whether it's relationship status, skin color. We always say, like, are we looking at this ad? Does this ad look like America? If the answer is no, we probably need to do a little bit of work. So again, it's every level, and it has to be as a leadership.
Love that.
I like that a lot, Melinda. And I think that it's really interesting that there is always there's like a strategic approach to it. I'm sure you guys, because you're so culturally sensitive, you're getting a share of the population that most people don't know how to get to because they just have one theme or one look. So I think that could be the way we think about talent is also very strategic. We don't want to have a diverse culture to check a box or to put an infographic out there. I honestly think there is an advantage for us to benefit from, which is most of the companies will ignore Black, Latino, Asian applicants. Well, I know they're going to be as talented, if not more, but I do know they're to get to where they are, they for sure have had to go through more challenges and hurdles. So to me, those of us who value that are at an advantage where you can really get talent that other people overlook. The one thing you mentioned on the pipeline, maybe you guys have done a great job getting to those folks, but the truth is that you two are truly unique individuals, right? How many females, how many Latina CMOs were there at United, or how many successful startups have a Latina or a Black or even just a female CMO. So I think there are still some of the challenges in the system. So I guess a follow-up question that I have for both of you is, how did you do it, right? I think you two are the perfect role model. How do you break through all the challenges, all the biases in the system to be incredibly successful. And I can't speak to that because I get a pass because I didn't have to go through that myself. But would love to hear from you guys because I think it'd be very inspiring for other people to follow your lead.
I'll go first, Melinda, and then I'll turn it over to you. That is a really, I think, an important question. When I think back to my years at UHG, I was unique in that there were many female leaders, and we had a widening group of Black female leaders, but very small group of female Latina leaders in clinical roles. I'm trying to think of non-clinical roles. We probably had more there than physician Latina leaders. I might have been the only one. So and then secondly is, as I think about how did I get the opportunities to promote into influential roles in my my tenure at United Health Group, I intentionally, and I was raised in a family. I have four grown kids. Linda, you're just starting this beautiful thing, but I was able to do it with support from my family, absolutely. But I also looked for mentors within the enterprise that I trusted, that I admired, right? They're always everywhere, wonderful leaders. There's also, a handful of not so wonderful leaders. So you learn from both the positive and the negative. But I intentionally went out and sought out mentors that I felt like could help me, develop those opportunities that would help me get into roles where I could be more influential and do great things. And, like landing the role of the chief medical officer for United Healthcare's Medicaid and dual eligible programs, a Latina leader across, it was like, that was my dream job. It really was. And I was like, oh my God, well, the way I got that was that mentor. And it was actually a male physician, not Latino, who was an amazing leader. And he was very forward thinking in terms of the quadruple aim and health equity. And so I found the right mentors, and that is what helped me kind of land the role, my dream job, but also land those positions to be able to be visible. Because the other thing is in order to promote in large enterprises like mine, was you needed to put yourself out there. You couldn't be shy, you couldn't be a wallflower. You needed to get outside your comfort zone, have mentors that would help you get that visibility, but also take some bold challenges and really get outside your comfort zone. So like I'll give you an example, and then I'll let Melinda answer it from her perspective. But I'm a great teacher, but I'm not really fond of getting on the platform and being in front of thousands of people. I had to get over that. I had to get good at that. And that was for me. And now I'm good at it, but I wasn't. And I really did. I would stress out about it. But that mentor, like multiple times, put me on a stage in front of thousands of people and that allowed those others to see me within the enterprise to say, oh God, Anna's a pretty good speaker, and oh God, she's Latina, and oh my God, she knows Medicaid, and oh wow, she's a geriatrician. And that gave me the platform and the visibility to have people think about me when jobs came open. So that was the risk, is taking a risk.
Yeah, I agree. Mentorship is huge. I think for me also, like, education was really, really important in my household. And my mom, from the beginning, just would not accept anything less than our best. And I think I was very blessed with just curiosity. I love learning. I'm very proud to say that I started a homework club in my neighborhood. We would do Saturday school in my house, which my brother would hate, but we would take turns teaching one another new topics. My mom would reward us by taking us to Lakeshore, which is a store for teachers to get educational materials, but we'd go there and buy posters of the 50 states and like different educational things and have it all around our house. So it was very crucial. And my mom also would give me, books to read. I read Think Big by Ben Carson. And so I was like, okay, I'm in a similar situation, and he used education to get out of poverty. And this is like my roadmap. I had no idea what other careers were out there. And even when I was at Stanford and my classmates were doing internships at banks, I kept thinking, you came to Stanford to be like a bank teller? I had no idea what investment banking was, business school, like that even existed. And so a lot of ways I was just trying to find some kind of map. And I got some great advice when I was in college, which was, exactly what Anna mentioned, which is find mentors. And the mentors may not look like you, and most likely they will not look like you. And the follow-up advice was, as a woman and as a woman of color, potentially when you're looking for mentors, they are going to be white men. So look for one who has a daughter or many daughters, because he might see in you the same spark and fire that he sees in his daughter, and in that way might want to help nurture that and help see you through. So I'm very grateful to both men and women mentors that I've had over the years, especially growing up in Roswell, Georgia. Most of my mentors were Caucasian teachers who really, saw something in me and pushed me forward. And I think also being in Atlanta, there were a lot of opportunities for Black and Brown children. So I was always, I'd come into homeroom and there would always be some application on my desk for some summer program for underrepresented minorities in Atlanta, or I went to a summer program at Duke. And so people were thinking about me. And then I think as a professional, absolutely raising your hand, even when it's scary. And I have many stories. I am an introvert. Even right now, I'm a little bit nervous speaking. But my tricks when I was first starting out was I wear glasses and contacts, and I would wear my glasses to a speaking engagement, and then I would take them off. Then I couldn't see anyone. And so my voice would start shaking a little bit. I take my glasses off. I'm blind. I can't see people. And then I could take a breath and just sort of relax and speak my truth, because I knew that I had to be twice as good for people to just think that I'm half of what I am. And I knew that if I could just show what I could do, that there would be no denying my talent and my capacity and my capabilities. And so I just needed to not get in my own way. And fear was trying to get in my way. And so I just had little tactics like that to try to help me do speaking competitions or speaking engagements. And so absolutely, if you put yourself out there, people can see what you're doing. One, it's hard to deny it. Then they tell other people, and then you get invited to more things. I think that I'm living that truth right now as Chief Medical Officer at Roe. And then the other point I would say is, do not let others' small-mindedness limit your vision and limit your truth about yourself. And so when I was at jobs where I felt like someone was trying to limit me, they were trying to put me into some box that was minimizing my abilities, my first reaction was, okay, I'm going to try to prove them wrong. I'm going to try to show them what I can do. But at some point, I then had to say, this is not healthy or successful. This is not good for me. So I need to go somewhere else. And so that is crucial to me. Even when I was looking at colleges, where am I going to go where I actually felt like I could be me? I was valued. I wasn't going to be restricted or put into some kind of category. And so when I was interviewing at Roe, I saw a lot of things that were signs that this is a place where I could grow. Zachariah, our CEO, his dad is a physician, and he's the physician in residence for the company. So that not too many kids can work with their dads where they're actually kind of telling their dads what to do. They had a great relationship. They had a great dynamic. They were very family friendly. The original team, when I started interviewing with Roe, had 30 people. It was already diverse. They were looking to bring in more people of diverse backgrounds, and it seemed to be very important. And while a lot of other health tech companies that were direct to patient or direct to consumer were trying to attract, white millennials, they were putting people of color in their ads, and they were really trying to attract, again, patients that really reflected our country. And so I thought, okay, this is a place where I think I can add value, and I think that they will value me. So I would say, to anyone listening, if you're working at a company or you're in a situation where that's not the case, people are actively working against you, sometimes the best way to flourish is to go someplace else. You can keep fighting, but definitely don't stay there and let them continue to diminish you. So if you want to fight, fight, but don't start to believe their hype that you're not as great as you are.
Awesome. Thanks, Melinda and Anna. I think a follow-up question I'll ask, which has actually come up in conversations, just with some of my peers from graduate school and I think in the Latino community more generally. There is a tension there, right? Like between what you both describe, being trailblazers in your field, and also trying to figure out the places where you're, belong and supported and accepted. And I guess, how do you think about that trade-off, and kind of when it's the right time to stay and fight and when it's the right time to make a transition? Because I imagine there are many situations where as the first in a startup or in an environment that is new, if that's educational or professional, you're probably going to be feeling a lot of those feelings.
Right. Melinda, do you want to go first on this? I'm happy to, but I haven't let you go first yet.
Sure. I mean, I think, a lot of it is looking at sort of the environment. And I think, are there allies? Are people actively, sabotaging you or putting you down? And I think, again, it goes back to what we've talked about, the leadership. What do the leaders at the company value? Do they value diversity, equity, and inclusion? And there's ways to look at more than just what people say, but to look at their actions. And that does look like hiring. It does look like middle management. What do those people look like? It speaks to just even, are there different employee resource groups? Like, how are they demonstrating their commitment to diversity and just to other people who might not fit into the dominant narrative of a white cisgender man? And so, at least for me, some of the things that I looked at, so when I was looking at Mount Sinai, I knew I wanted to go to medical school in New York City. When I was looking at the different schools, Mount Sinai just proudly on their landing page talked about their Students for Equal Opportunity in Medicine group. They talked about really owning their location sitting at the junction of the Upper East Side and Spanish Harlem. They talked about going into the community and trying to understand why asthma was so much higher in East Harlem, Spanish Harlem, than any other place in Manhattan, and basically figured out it was because that's where the bus depot for MTA was there in that neighborhood, and they were idling the buses in the morning when they started or in the evening before they shut them down. And so I thought, like, that's just amazing. I mean, this place is actually like walking the walk, because a lot of schools said that they valued diversity. They want to have cultural competent care. But there was no evidence of that anywhere in their literature, their website, the tours of the schools, the interviewers. And I thought Mount Sinai was actually doing that. They had it on their website. They had demonstrated examples of working with the community, whether it was health fairs, working at free clinics, having translators, thinking about cultural competency and even cultural translators and not just language. And so it really became a no-brainer to want to go there for school. And I think it's the same way for the jobs that I've had afterwards, is that has to be top of mind for me. And I just was unwilling to sacrifice those principles and sort of just almost deal breakers for myself. I was not willing to sacrifice my own sort of self-esteem and self-worth for a job. And that may be speaking out of a place of privilege, but that's how important it was for me.
Oh, those are great points, Melinda. I'll just add by saying I totally agree with all of what Melinda just shared. I think as I think about an individual, a Latino, trying to decide, do I stay or do I go? I think it's not an easy decision, right? I think there's a lot to be said about staying because you develop your brand, you developed relationships, you are hopefully working on important things that really make a difference to the Latino community, right? So I would say it's a balance, right? However, if you don't have, if you're not respected, if you're not included, if you don't have authority, those are things I would look for, to put yourself out there with your manager, your leaders, and say, you know, we're forgetting about this population as we do these things at this project is not addressing it. So I think I would say maybe before you consider leaving, try to work with that leader, your leader, to address the issues that have you concerned about prioritization of, you know, a prioritization that maybe you're not being listened to, or the work that you're doing is not relevant to the Latino community, whatever those issues might be. So there's a lot to be said about longevity, is I guess my point, is that I think it is important to leave if you don't have respect, you're not being used to your fullest, you're not being given authority to, you know, take action on things that you should be able to take action on. So I think be careful, but I agree with Melinda that there are times where it is time to leave because you aren't given those opportunities to grow as a Latino leader. The other thing I would say is a kind of a missed point that I probably should have made earlier on one of the questions, but I think it's relevant here, is to be data driven, right? And I think Melinda made some really good points about the institution she was talking about. Is data matters, right? And how we use the data matters. And so making sure that we are using facts and not fiction or no data at all, especially as we lead and as we serve the Latino community, right? So, you know, it's today, as we think about health programs across the country, we have a very poor data on race and ethnicity and culture. And so, you know, I think it's important to think about that. And especially as we make decisions about, do we stay or do we go? Because one of the things I think is really relevant is, you know, you can influence by influencing how we use data, and making sure data is not biased, and making sure that data is being used correctly. And sometimes that data might influence your decision about, do you stay or do you go?
I think that's great, and always important to be data driven. Okay, I'm going to come to Carlos for our last question first. So you're not off the hook. You guys have given so much incredible advice over the course of this hour we've had together, and you've also grown into these like absolutely incredible and inspiring healthcare leaders. I'm sure there are many folks who are listening today who are curious and trying to understand how they can grow their careers and be more successful. And I think some of the points you've already brought up around mentorship and sponsorship are really impactful. So I guess the last question I'd like to close with is, if you were to give one piece of advice to your younger self, what would that piece of advice be? And you can kind of take it in a professional or personal direction. And Carlos, I'll start with you.
Yeah, happy to provide my perspective. It's also connected to the last question and the points that Melinda and Anna were making. If I think about our experience building the business, we didn't have the opportunity to leave, right? And you know, we were trying to fund a business where we know, you know, when you hear the stats, less than 1% of the venture capital goes to, you know, Black and Latino founders. And here, you know, we had one Latino and one Black founder trying to get a company financed. So we were that less than 1%, and that we couldn't go elsewhere, right? There's, you know, and we didn't want to give up because the mission was very important. So I think when you don't have the privilege of going elsewhere and you have to, you know, go to the fight, you have to first believe in yourself. Back in the early days, we were also not very backable as entrepreneurs, first-time entrepreneurs. We didn't have the experience. We hadn't built anything before. We didn't have the network, but we were able to do it. And we are like a very small example. There are so many more, and so many folks who had it even more difficult and have built more successful careers. So, you know, I generally think if we were able to do it, you are able to do it. And I would say that to everyone. And how to go about it, you have to be very smart. And coming back to the point that Melinda and Anna were making, you have to find those allies and, mentors or supporters. Who were some of our first investors? They were, yes, many of them were white men, but they all had some connection to us or our values. Probably have more Hispanic and then Black investors than the average startup. Well, yeah, we were smart about it. That's where you will find people who want to build a relationship with you and invest in your values. Or even if they're not Latinos, they had some connection to it. So I think that's something that everyone should look for. If you want to find a mentor, an investor, someone to support you through your career, they need to be personally connected to you. So, very, very good place to start is go find those commonalities. If you are a, Latina in Arizona or a clinician, reach out to Ana. Like, don't even think about it, because she's gonna be willing to help out. If you are, even from Panama, or you're a Black surgeon, yes, Melinda's gonna be interested, because they'll find those things. And I think generally there's always an opportunity to find those points in common and get you the help to at least be able to get to the level of having the network and the support that your peers will have as an advantage to you. But always believe in the things that you can do, because there's definitely a possibility to get there if you work hard and you're smart about how you remove those hurdles that the system has put in place for you.
Awesome. Anna, want to go next?
Sure. I love this question, and I think about it a lot, believe it or not, and for the reasons I mentioned earlier, that I'm disappointed in America, and that we still are talking about health disparities today. So I would say, if I could talk to my younger self, I would have, back to some of what Melinda shared, I remember as a college student and then as a medical student, I spent a lot of time in high schools mentoring sixth graders and up, and trying to influence, especially the girls in the class, a lot of them Latinos, because I'm talking about where I was raised in Latino communities in Tucson, Arizona. But I would say, I wish I had kept doing that. And I didn't, because life gets busy, right? But imagine if every Latino on this call and all of our families mentored high school kids to go into the health sciences, to stay in school, to graduate, for goodness sake. Wow, we would change the social issue for Latinos in America. Because I think if we just think about health equity as a one thing, healthcare is not going to fix it. It's the social imperative is graduate our kids from high school, get our Latino families out of poverty. To Melinda's point, I was in the same situation. My parents were educators, and they believed that their kids needed to graduate from high school. I have 4 high school grads, 4 college grads. That's like a major success story for me and for my kids. Imagine if every family did that. I would challenge us. That's what I would tell my younger self, is don't stop mentoring and get more people to mentor at the high school level so that kids will graduate.
Awesome. And it's a good call to action, I think, for everyone on the call. Okay, I can think of no better way to close than with you, Melinda. So, but not least.
The advice to myself, I'll just keep it short, which really is go with your gut. There were many people, again, my theme is always do not let people's small minds narrow your huge dreams and your big vision. And I just see that so often, where there are people who are parts of marginalized communities, whether it's being an underrepresented minority, being a member of English as a second language, or gender identity, or sexuality, just go into the corner and wilt, and their dreams die. And that is so painful to see. And so I will echo Anna's call to action. And that's something that I've been speaking about in groups of Black or Latino groups, which is, how are we formalizing mentorship? How are we making sure that we are paying it forward? I say this on every call, and I always give the caveat of, like, it does make my life, a little bit more complicated. But when people reach out to me on LinkedIn, I have on my calendar 20-minute slots to speak to people on LinkedIn. You cold reach out to me, you send me your resume, you have some question that you would like for me to help you with, I will write back you will get on my calendar, we will have a conversation. There are many Black and Hispanic, and I would say just people of color that I've spoken to and been proud to have continued connections. But we need to formalize it, because absolutely, to Anna's point, like there are people that I remember speaking to when I was in high school and was very connected to the community. And I don't know where they are right now. I don't know if they fell off. Did they finish college? Are they in medical school? And even right now, the people who I choose to surround myself with, I try to have, babysitters for my daughter that are Black or Hispanic. I want them to be in college. Are they in community college? Are they in high school? Am I mentoring them just even informally to make sure that they know how to get to the next level? We have to do it in our little actions and our big actions. Just like we're asking our leaders at work, we have to hold ourselves accountable as well. So I would echo that call to action, which is how are we formalizing? How are we staying connected? And we have to pay it forward.
Love it.
Love it. Thank you so much. Le agradezco. Thank you for your time, everyone. Thanks to all who listened and attended. And for the Rubicon folks, the session was recorded. So, you'll have the opportunity to watch if you had to hop on a little late. But yeah, just thank you again, everyone, for your time, and have a great rest of the day.
Adios.
Adios.
Gracias, Maddie. Ciao.